Drugs Authority, in collaboration with Food and Agriculture Organization, has launched the World Food Safety Day under the theme Safe Food Now for a Healthy Tomorrow. This year's theme is to inculcate the idea that safe food production and consumption is beneficial for all. Dr. Kwabena Boedu Oku Afari, Chief Director at the Ministry of Health, who spoke on behalf of the sector minister, noted that
safe food poses a constant threat to the health of consumers. Instead of providing nourishment, unsafe food has a potential to cause disease and death. Achieving the Sustainable Development Goals 2 is not simply about providing adequate food for everybody. It's not just a matter of eating to fill one's stomach, but also ensuring safe and nutritious diet for all. Occasion is therefore the time to take advantage of this heightened awareness and project food safety to the front and center of efforts to achieve the SDG 2, which is zero hunger for all. Zero hunger for all. It is clear that the lack of collaboration among the various sectors ensuring safe food supply, safe food from tillage to table, from muddy to mouth, from boat to bowl, requires a strong collaboration of all stakeholders, public sector, the private sector, and consumers. The road to SDG 2 therefore lies in food safety for all.
The Chief Executive Officer of the Food and Drugs Authority, Mrs. Delise Dakun, indicated that the regulator in the food supply chain has initiated some food safety agendas, adding that the outbreak of COVID-19 has compelled all stakeholders to be strict on all safety standards.
Happy to share with you some of the work that we at the Food and Drugs Authority have initiated to ensure that food safety remains a priority for governance and for the country as a whole. They include continuous public education in schools, marketplaces, and other public places, including transport stations and terminals. Training workshops for food manufacturers, service establishment operators, and street food vendors. Facility inspections to bring manufacturers and food handlers into compliance with good manufacturing and good hygiene practices. Introduction of the progressive licensing scheme to bring particularly local micro and small-scale food manufacturers into compliance with food safety requirements. Monitoring of foodborne disease outbreaks, and also the introduction of our flagship consumer complaint system for effective reporting of food safety outbreaks and food safety breaches. The COVID-19 pandemic has made it a lot more compelling for even stricter adherence to food safety standards in order to help boost the immune system and prevent disease transmission. As a food safety protocol, regular hand washing is very important, especially before preparing and eating.
The World Health Organization's report indicates that 1 out of 6 persons, representing 600 million people across the world, fall ill after eating contaminated foods, and nearly 420,000 lose their lives. Dr. Francis Kasolo, WHO representative to Ghana, said the World Bank estimated in 2018 that $110 billion was lost due to health conditions relating to contaminated foods.
Food safety-related illnesses and deaths are high, and we've been given a figure of 600 million illnesses and 420,000 deaths. But closer to home, on our continent, these numbers translate to 91 million people falling ill from consuming contaminated food, and approximately 137,000 people dying every year from ingestion of contaminated food. Contaminated food is responsible for a range of illnesses, from acute conditions such as diarrhea to lifelong conditions such as cancer. It does not only cause ill health, but there are also social and economic consequences. And we've been told $110 billion is lost annually in low and middle income countries. Huge economic loss that would have gone a long way towards improving the economies and the social development of these countries, and indeed improving the lives of our people.
Joycelyn Jakwa Amusa, head Food Safety Management Department of the FDA, explained the importance of the emergency response plan rolled out by the FDA with support from the WHO.
The Food Safety Emergency Response Plan is the plan that has to be put in place to be able to trigger or something that we need to have in place as a country if we need a food safety alert system. Every country has to have a food safety alert system, and what drives that system is a plan, and that plan is the Food Safety Emergency Response Plan. The plan is such that it has all the players along the food chain in the know, and then whenever there is an emergency, they know the role that they have to play. And it's such that timeless information gets to these stakeholders as soon as there's an emergency, so that everybody will act quickly to play their part, such that food safety emergencies can be arrested on time so that it can save lives. Today, we are commemorating and creating awareness of food safety. Food safety is the target. Whatever that we are doing, we want to achieve food safety. And to be able to achieve food safety, that means that we should have a system in place such that we are able to arrest situations so that food is not contaminated. That means that the way food is handled, the way food is sold, both in the market, when we buy it, how you transport it, how you handle it at home. These are all things that we need to really take care of when it comes to food safety. The handling is critical.